Will this lead to tighter restrictions? To discuss this, I'm joined by Professor Koleka Mlisana, co-chairperson of the Ministerial Advisory Committee, and Professor Rudo Mathiva, head of intensive care medicine at the Hani Baragwanath Academic Hospital. Thank you so much for your time. We appreciate it. So let me start with you, Prof. Mlisana. Of course, the latest figures are very worrying. 17,493 in the past 24 hours. Gauteng's figures are at an alarming rate right now. Do you think there should be tighter restrictions?
Good evening, Shahan, and thank you for having me, and good evening to Professor Mathiva. Yes, we are actually in a serious crisis as we speak, and as you correctly say, if we're looking at the numbers, we have not seen such numbers in the Gauteng province to actually account for more than 66% of the new cases within 24 hours, more than 10,500. So the question then becomes, with the current restrictions that we have, how is the public responding to that? And secondly, what else can be done to actually, ensure that we are able to turn this around? It probably means, Shahan, we need to actually look at what further restrictions can we get into, but at the same time to look at, because we saw these numbers coming up, and obviously once we see the numbers, we knew that it's going to mean increasing hospital admissions. And I think for me, the other big crisis is, at the moment, how do we ensure that we are increasing hospital beds in Gauteng? Because I think everybody realizes that, we're in a crisis. And so whilst, yes, we put restrictions on one hand, but we need to ensure that the facilities and resources that are required to increase hospital beds, ensure that there is staffing to man those hospital beds, ensure that, if we need oxygen, there are processes very clearly in how to actually access oxygen. So for me, those are the things that need to be taken into consideration as well.
That should have been done, though. We should have better prepared because we had a first and second wave. So why didn't that happen? And who should be held accountable? Because our government has experience with this virus for over a year now.
Oh, well, yes. Well, and I mean, from where we sit, as the advisory committee, we have been saying this, and at the end of the day, when it comes to healthcare facilities, it becomes the responsibility of the Department of Health. At provincial level, therefore the question is, because we have had these experiences and we actually have got the data, we even modeled the numbers and showed that we are getting to this. And as the advisory committee, we said, we have actually had some of these field hospitals before. Let's get those ready. And the question that we need to face is, when is that going to happen? When are we going to see extra beds for Gauteng? And really, that for us is causing a lot of anxiety to us as a committee. And we do need to actually get that done. And it should have been done last week, as you are saying correctly so.
So has the Gauteng Health Department failed to get this right? Have they failed to do their jobs when it comes to this pandemic?
I'm sure Professor Mathiva would actually be the best person, because she is actually working, she actually sees what is happening. But from the reports that you are getting is that, the department has failed in that we don't have, well, actually we are looking at over, more than 100%, bed occupancy in some hospitals. And the question is, what then is going to happen to patients when they need to go to hospital? And where are the beds? Where is the staffing to actually look after these patients? And so I think for me, the best person will be the one who is hands-on, but we really just feel when there was time to prepare, we are not seeing that preparedness coming through, because there actually were even, surge plans that were put in place, and now we're not seeing those coming up.
Yeah. So, Prof. Mathiva, you, of course, according to Prof. Koleka Mlisana, is the right person to answer that question, because you do work at the Hani Baragwanath Hospital and you are a member of the Ministerial Advisory Committee. Has the department in Gauteng, the health department, actually failed its citizens because it didn't prepare adequately for this third wave?
Okay, Shahan, I think this is where we take a breath and we take responsibility, all of us. This third wave was coming. COVID never bid us goodbye after the second wave. And we cautioned when centers like Nasrec Center was closed. When the Charlotte Maxeke Johannesburg Academic Hospital went down more than 60 days ago, we knew we were facing a crisis and our COVID numbers were already starting to climb. And there was just a relaxed attitude on our provincial health department's part in not planning. And the healthcare facilities started taking strain because they were carrying an extra load of patients. On the public side, the public were already in COVID fatigue. They just couldn't care about protecting themselves. And we, as healthcare givers, we were not sending out a strong message. And this also involves national health. We did not push the message that the answer to mitigating against the spread of this virus actually lies in the hands of the public, that they should stop the spread of the virus themselves, stop the infection, because the answer does not lie in the hospital bed. Right now, we're seeing that we have pressure on beds in every single facility because we are 1,000 beds down in Gauteng in the public healthcare sector. The private healthcare sector is full and patients keep on coming. People are infected. We cannot stem the infections. We are in winter. Winter is an environment that perpetuates the COVID infection momentum. There's overcrowding in households. There's respiratory tract infections going on, and the virus just replicates and infects people. So that is the problem.
Tell me about the situation at hospitals, because whenever we speak to the premiers in provinces, they seem to say that it hasn't reached a point where people are being turned away. But then we have healthcare experts who are working in hospitals saying actually people are being turned away. They're even being told to wait in their vehicles in parking lots. What is the real situation at hospitals in Gauteng and the rest of the country?
Okay, I'll talk about the hospital I work at, Hani Baragwanath Academic Hospital. So people wait in queues. We cannot turn people away, but they will wait in queues. And some of them will wait in casualty for up to 2 to 3 days, maybe on oxygen, lying on a stretcher, until we find a bed for them. Some patients will expire before we even find a bed for them. That is how bad things are. This is the reality of the situation. And I'm not going to give you a feel-good message because that is not what is happening in the public hospitals. We do not have the luxury of telling people to go sit in their cars outside, especially the very sick patients. So we will try and park you on a bench or on a chair and try and get an oxygen cylinder and put you on oxygen if you need it, while we try and find you a bed. And quite often it's difficult to find you a bed because with the current overcrowding, we are no longer able to convert existing beds into COVID beds when we face increasing numbers of COVID positive patients. And this is the reality that the public needs to know. And we are not telling them the truth. This is the truth at the hospitals, people. We need to know that. We are unable to decant our hospitals because we're still carrying a lot of extra patients that do not have COVID from the fallout of the Charlotte Maxeke Johannesburg Academic Hospital closing, because we still need to provide those healthcare services that hospital used to provide. And these are seriously ill patients, oncology patients, cardiac patients, very serious surgical patients that we need to take care of. We are carrying a trauma epidemic burden that we have to attend to. We cannot turn those patients away. Yes, there are physical structures that have been built in Gauteng. They are called ABT structures, that some of them have 500 beds, some of them 300 beds. But the reality of the situation is they do not have staff to run it. You talk about the military being deployed in Gauteng, it's a joke. 5 doctors and 44 nurses. What are they going to do? As we speak, those soldiers won't even come and work at Hani Baragwanath Academic Hospital until they are offered accommodation at the hospital. We don't have that luxury. They also want to be vaccinated first before they'll come and work. What do 5 doctors do? We are already like 60 medical officers short at Hani Baragwanath Hospital. Our staff is getting sick from COVID, from stress-related diseases, because they are also tired. They are morally injured. We are exhausted. We need to protect each other, South Africa.
Yeah,
Thank you.
It's very worrying to hear you say this, especially because the SANDS deployment was punted as a so-called savior for the healthcare system in Gauteng, but you are saying it is a joke. Prof. Mlisana, I have to bring you in because you're the co-chair of the Ministerial Advisory Committee. You hear the shocking information about everything our government is doing to try to deal with the third wave. And the one thing that I'm picking out here is failure to prepare. And it's really outrageous that it's gotten to this level, because we knew about this pandemic since March last year. And we are now talking about this in this month of 2021. You know, for me, I know that we can say the public needs to be held accountable as well. The public needs to act within, regulations and have safe social distancing, wear masks, etc. But our government is in charge of this pandemic right now on our behalf, and they are failing to do their jobs. So what do you do as the Ministerial Advisory Committee? What advice do you give to the President?
Okay, firstly, we advise the Minister of Health. So what advice do we give to the Minister of Health? And even though you are saying, yes, the communities, we know they are responsible, I do want us to always start there, because it is the sick individuals who then come to healthcare facilities and require healthcare services. And so there's a responsibility that they do have in ensuring that they adhere to these regulations. That we cannot, I can't have an interview without highlighting that. Now, having said that, the next thing that then has to happen is what then is happening in the hospitals. And as Prof. Mathiva has actually outlined the concerns that are the serious concerns, it therefore is important to be saying to the minister, we need to ensure that those field hospitals that were there before, those extra beds, we need to have those and have them yesterday. In fact, we're even thinking as the MEC that we probably do need to have a system where each and every province can put out the number of beds that they have, number of hospitals that they have, how many beds, so that even the doctors would know where are the beds, where can I refer, our patients. So really we need a system that's going to resolve the acute shortage of beds. And secondly, as already mentioned, we have got to put in resources as government. We've got to put in resources. We can't just say, yes, there are beds in a certain section of Hani Baragwanath Hospital, but we don't provide the resources, human resources, to actually look after that. So really we need to make sure, the government needs to make sure that they put in the necessary resources, and that must be done quite urgently. And then really it becomes important to bring back these resurgence plans that are there already. Let's see them being activated, and so that we can catch up with whatever, because we've lost a number of days already. So we really just don't have enough time. And when I look at it, I did hear the minister earlier saying that they have also called out to other partners to come in and assist. And we would welcome that because we really need as many hands as we possibly can. We have failed to act on time, and this is the situation we're finding ourselves in. Let's find out who then can come in and assist. I often hear of nurses who are retired or even doctors without jobs. How do we bring those back in if we require those resources? So really there are a lot of issues that need to be done, and that must be done yesterday.
Yeah, you know, I asked you what advice you have for the president because I feel like whatever advice you've been giving to the health minister, the one who's now been suspended, and the acting minister isn't filtering down to the president. And that's why I asked you what your advice would be to the president now. But don't answer that right now. I'm going to go to a short break. We're going to come back. I'm going to get that answer. I'm also going to ask you about whether you think there should be a booze ban, etc., in a moment. So stay with us. We appreciate everything you're saying. If you are just joining us, I've got to tell you, this is a very shocking conversation we're having. We find out that we have 17,000 new infections in this country, Gauteng making up the majority of those infections. And then we hear from the Ministerial Advisory Co-Chair, Professor Koleka Mlisana. And then also we're speaking to Rudo Mathiva, also Professor, a part of the Ministerial Advisory Committee, and also the intensive care medicine head at Hani Baragwanath Hospital, painting a picture that we should be ashamed of as a country, especially as our government. So I'll speak to them after this. Stay with us. This is Newsnight.